Your unique story, our global audience. Global One Media.
Hello, I am Munir Barazi, your business analyst and host. Welcome to Global One Media, and thank you for joining us in this series of interviews where we have one-on-one discussions with leaders of companies from different sectors to help you understand the value they are offering, their operations, business models, and great potential. Joining me today is Dr. George Adams, the chairman of the board of Ventripoint Diagnostics, a company that has developed diagnostics to help understand the structure and function of the human heart without the need for MRI. Hello, George. Thank you so much for joining us today.
I'm happy to be here. Thank you for inviting me.
So during the last interview, you talked about your diagnostic devices from a medical standpoint. And today, I believe our viewers would want to know more about the commercialization of those devices. How focused are you at this stage on commercialization and building a pipeline of interested customers? How much of your resources are dedicated to this side of the business?
Well, that's exactly where we're at. We have now got all our regulatory approvals from the US FDA and Health Canada and the CE mark for Europe. So we are fully able to go out and sell the product. We attended 12 conferences this year. First half of the year were virtual conferences. The second half were one-on-one, actual person-to-person conferences, which are much more effective in building leads. So that's been our focus all year. It's going to continue to be our focus. I mean, bringing a new medical technology device into the marketplace takes time and effort, but we are encouraged by the responses that we're getting from the leading cardiologists worldwide.
So you have achieved many important milestones. And since you're offering advanced and sophisticated medical devices, then arguably the sales process for those devices involves many incremental steps. Could you walk us through those steps in your sales process until you eventually sign the contract?
Sure. I mean, it's, those are great. We have metrics all the way through the process, and our salespeople follow those metrics very carefully. We really need to understand, where we are in the process with each one of our customers, as well as a global understanding of how we're doing within the marketplace. So, as I said, the first approach here is to go to a conference, be part of an exhibit, have the equipment in the exhibit hall, and have some of our key users present at those conferences, so people understand that here's a new device and here's the patient population that it can be used with. From that, you get a name, a contact, some kind of a phone numbers. So you can, and people are busy at conferences, so they say, come, call me later. So that's the lead. And so then the challenge then is to call them up and say, with a little bit more time, get them on the phone. That's, takes some time. Sometimes as people, these are all busy clinicians. But you get on the phone, you say, you understand the value proposition. We're, as good as MRI, but it doesn't take 2 hours. It takes 5 minutes. You're an echo person. Is this of interest to you? And at the same time you're doing that, you're also trying to qualify that lead, which means you want to know, are they interested in next month, the next 3 months, the next 6 months? Do they have money to buy the equipment? We go over the price of the equipment with them so that they understand, it's not expensive. It's very, it's a fraction of the cost of even a 3D probe for an ultrasound machine. So, the price is very reasonable. And so, but once you've gotten through that interview with them and you know that they're interested in the next short period of time and they have money, then you call them a qualified lead. And then you say, let's have a virtual demo. So we can set a time with them and a few of their sonographers and other cardiologists, perhaps, to get on and go through the steps of the procedure and show how well it integrates into what they're doing now and how the data would be much better. If they're still interested at the end of that process, then we say we'd like to introduce it to everybody in the cardiology department. We'd like to come on site and do cardiac rounds. With all clinical places, they get together once a week and present a case or do something or have something. So we would go to the site, set up our equipment, and actually show them how it works and let them use it hands-on and do an on-site demo. After that, we typically would say, and we've had this year, the last 6 months since we've been doing one-on-one be able to get into hospitals and actually do these on-site demos. We've had 100% success that they say, we want to buy it, let's have a quote. We give them a quote, that goes off to the purchasing department, and they go through whatever their internal processes are to generate a purchase order. And that process is different in every hospital, has different levels of sign-off. And that's the one that's the biggest black box for us, because we really can't look into the hospital and say, where is our requisition in the process of generating a PO. Eventually we get a purchase order, and that's great. Then we can call up the bioengineering group and the IT group in the hospital and schedule a call with them, so we can explain to them, have all the qualifications. The bioengineers are worried, have you got CSA, have you got UL, have you got this, have you got, all your regulatory certificates to make sure it's allowed, that piece of equipment is allowed into the hospital. And we go through them, a delivery inspection. So when we deliver the equipment, they're ready to take it out and go through the checklist and make sure the equipment didn't get damaged in transit. And then we and the IT guys, we have to hook it in, because we're dealing with collecting images, and those images are going into the PACS archive server at the hospital. We have to hook into the IT in the hospital. So the IT department is always leery of hooking up some new piece of equipment into their network. So we have to go through with them exactly. That's, what their concerns are. Never an issue out of that, but it's a process you have to go through. And lastly, we send out the team to install the equipment and train the doctors and the sonographers to use it. They usually like to do, 4, 5, 6, 10 patients while we're there, just to make sure they feel comfortable and they get the right results, and they validate for their own minds that, yes, this is giving us good data. And then we send them an invoice. And hospitals typically pay those invoices, 60 to 90, 120 days. So it's a complicated multi-step process, but it's the same for everybody, and we're not about to change that process for sure.
It's a complicated process, but you have a good structure, as I understand, and it does require a lot of communication and cooperation within the company and with outside customers. And I imagine that, given the number of steps involved and the complexity of this process, then it would require many people and take some time. Can you tell us about the expertise on your sales team and the length of the sales cycle?
Right. So we have salespeople who have been doing this for 20, 30, some of them even 40 years. So they've been through this cycle, and most of them know the purchasing, and they work in specific regions. So they have connectivity and long-term relationships with the purchasing departments of major hospitals that we're trying to get our equipment into. And so they know who to call and say, whose desk is this on? Can we move it along? So that's a really benefit. And that's the benefit of having local distributors. And we've been signing up. Part of that commercialization effort is to sign up local distributors. So we've now signed up one in Europe and one in the UK and one in the United States. We have a bunch more in the United States we're in the process of signing up. So those people already have relationships with the purchasing departments because they've sold them other things. They sell them other things. So that's the advantage of having a distributor. The whole thing, it used to be, could take up to a couple of years to go through that whole cycle from first contact to delivery and training and getting paid. Nowadays, and COVID made it worse. Nowadays, we're finding, because there's so much market pull for the technology, because there's so much need for what it is we do, we're seeing that cycle is collapsing down to about 6 to 9 months. We're expecting a number of purchasing orders that, for people that we contacted, late summer, before the end of the year. So that would mean under 6 months to go from lead to a purchase order. So that is, that's our experience now, that it's accelerating. But people need to be patient, because it does take a long time to go through all these steps.
Yeah, and it seems you have done a great effort in shortening that sales cycle and achieved lots of progress. And when we talk about innovative devices like yours, early adopters are crucial. And from then, it can become easier to build long-term partnerships with customers. Is that the case?
Yes, we just had a sales, we brought everybody into the office last week and had a big sales meeting to say, how's it going? Where do you think we're at? And again, these are people who have had 20, 30 years of experience doing this. So they have good insights. They've been through this cycle a number of times trying to get new technology, new machines into the hands. And they're saying, we've got our lead orders now. We've got our lead places. Once they're up and running, it'll start snowballing. We have, the top hospitals in the UK and in Europe and the United States coming online, and they say that's the beginning. Once you got the early adopters, and they start talking about it, and then everybody else wants one too. And they're saying they're already seeing us. They're calling up leads now as they follow up on them. They're saying, well, who else has got one? That's always the first question. And if you can say Dr. So-and-so at the major hospital in London, England's got one, they go, okay, if it's good enough for him, it's good enough for me. Come on over, let me see what it is. And, again, that first call is always about the value proposition of being able to, scan children, small children, even infants, even neonatal babies, with the equipment and getting accurate results quickly and easily without having to, anesthetize the patient to put them into an MRI machine, or even, very quickly in a couple of minutes of scanning and a couple of minutes of analysis, you can get an accurate result. So that's still startling, amazing to most of the customers we talk to. Those calls are always, wow, if you could do that, that would be so fantastic, but I don't believe you can do it. Say, well, let us come out there and prove it to you. And so it's our team is really inspired. They love to get those people who say, you can't do that, and say, yeah, yes, we can. So yeah, it's starting to snowball. Yes.
Wonderful. So great efforts on engaging all of those people and setting things in motion. My final question, George, are there other points you want to add that would be of interest to customers and investors watching us?
Well, I would just add that, we are working on the next generation of the product. You always have to be working on the next generation of the product. And so some of our efforts are into building VMS Plus 4.0. It'll be out later next year. And, we work with the top cardiologists worldwide to build in new functionality that nobody else has into that new machine. But right now, the VMS 3.0 is as good as MRI and is highly needed. And so we're focused on commercializing that. But we are inspired daily to try and make it better.
Wonderful. We look forward to hearing more about this. Thank you so much, George, for this information and for working hard on bringing beneficial and innovative diagnostics to market and helping patients in hospital. It is truly a great endeavor. I'm looking forward to seeing you again.
Well, thank you for helping us get the message out.